Thank you very much, David, and good afternoon to you all. It's a true pleasure and a privilege, actually, to be invited and to have the opportunity to contribute to this workshop and being part, really, of a great set of speakers. The session of this morning actually raised, really, the bar in terms of content. So hopefully, this will contribute to further our discussion on this important topic related to the development of collaborations and partnerships. When I looked at the workshop objectives and program, one way I thought I could potentially contribute is by sharing and hopefully discussing with you the importance of partnership development and implementation in the context of food safety and nutrition risk management. Risk management in and by itself requires collaboration and partnerships to be effective, and perhaps also discussing some challenges where these partnerships can find some difficulties in being shaped up and potentially developed. This is briefly the outline, sharing with you, again, something that doesn't need to be defined, the importance of these collaborative approaches, particularly in the context of risk management for food safety and nutrition. Drawing on some examples, even smaller examples at the domestic level. I would like to actually bring up some files and initiatives that I had the opportunity to work on when I was a regulator here at Health Canada. And also some other international initiatives, and perhaps discuss again some of the challenges and opportunities. I guess actually in the context of food, the way food is produced across the supply chain, the way it's consumed, the way it is overseen, requires obviously the contribution of a number of partners and a number of stakeholders in the way it is managed, particularly when we have a risk and a benefit to be managed. And when you look at the guidance that regulators receive across the world from the international food standard setting body that is the Codex Alimentarius Commission, right away when you look at the values of Codex, collaboration tops the values that Codex and the International Food Standard Setting Body advises regulators to follow. Inclusiveness, consensus building, and transparency are amongst those top values. When you look also at the guidance that was generated now over 2 decades ago for regulators and risk managers about the way food standards should be developed, these are the risk analysis principles on the basis of which food standards, whether be it domestically or internationally, need to be developed. Every regulator, every food standard setter knows risk assessment, risk management, risk communications. These are your 3 pillars. You identify that risk communication is in fact not defined as a small little circle. It is in fact that sea that surrounds the 2 other pillars of risk assessment and risk management. And the definition of risk communication is in fact not only communicating the risk by the simple definition of there is a risk and the consumer needs to be aware of it, but actually it's the engagement and the dialogue and the partnerships with the stakeholder community. So in fact, every risk management approach should be driven clearly with the involvement of all partners. I wanted to draw on an experience that I lived through when I was a regulator at Health Canada on a particular file that was and continues to be an important area of focus in the context of food safety management, and that is the management of food allergy incidents and how to develop risk management tools and particularly regulatory tools to advance the protection of food allergic consumers. This file, I think, is a good illustration of the way partnerships and collaboration amongst the players, the actors in this area really shaped the policy agenda and the risk management framework around food allergens. Definitely the way the food allergy issue was raised to regulators and actually to all opinion leaders is through consumers themselves. We happen to enjoy in Canada to have amongst the most active and the most effective food allergy associations in the world. They actually are a model right now being followed in terms of even capacity development. Food Allergy Canada, it used to be called Anaphylaxis Canada, a number of provincial organizations were really instrumental in raising this issue to regulators and identifying the fact that there are preventable incidents of food allergies and food anaphylaxis that could be attributed to food labels. And we know that food labels are regulated. Therefore, there could be risk management instruments that could be implemented in order to help avoid or prevent, in fact, these issues. The consumer community also was the link that we had with the clinical community. In fact, this is also something that the consumer community advocated for. We happen to have a limited number of food allergy specialists in Canada. In fact, I was advised yesterday, I was attending, in fact, a conference on food allergies where the number of allergists in Canada is less than 200. And not all of those actually specialize in food allergies in their practice. I mean, I think they do treat food allergic patients, but the number of health professionals that are actively even doing research in this area is quite limited. So advancing even this area, has been critical, and the consumer organizations supported that. The regulators obviously play a key role, and particularly when we identify that a number of these food allergy incidents are preventable, and that labeling, being able to have an accurate label, being able to trust that label, is a key contributor to the prevention of food allergy incidents. Definitely industry, in fact, I should have started with that, because industry is the provider of food. They are producing that, and I have to admit, when I started working on this file, I saw a note that was generated by, I guess, the predecessor of the Food and Consumer Products of Canada then. I think a note dated from 1997, where this was not really in the regulatory scope, advising their members to pay attention to the way essentially ingredients are being prepared from the standpoint of a number of priority allergens. And if we look at some of the accomplishments and how the different players work together, this is what I wanted to report on how, when you bring all these partners together, how you can achieve probably amongst the most effective results. I continue to actually give praise to our food allergy consumer groups because they really advocated very strongly on behalf of their constituency. They've allowed also their constituency to be heard. We've made a number of amendments to the original proposal of food labeling regulations related to food allergens, thanks to the input of the consumer organizations. Regulators, because of the interaction both with the consumer community, with the, thank you, with the consumer community, with the industry groups, but also with the clinical community, regulators in Canada were able to take action before labeling regulations specific to allergens were actually developed. I can share with you how they did that. Obviously, it involved some level of creativity, but it also involved a level of collaboration on the part of the food industry. I don't recall any member of the food industry in Canada that was facing a recall on the basis of the authorities that the regulator used that challenged such a recall. Those recalls were all voluntary and were actually undertaken. Again, industry as well came up with a number of guidances and best practices that were disseminated. Obviously, industry is not equal when it comes to making available these tools and disseminating them. And here, I believe that the approach that was used by industry then was this was not a competitive issue. This had to be broadly disseminated, and essentially the food supply chain depended on the integrity of the ingredients and the high level of knowledge of the composition of these ingredients in order to prevent those food allergy incidents. In fact, going back, the loop around the clinical community and the consumer organizations, those organizations became the focal point for risk communication related to food allergy recalls, for example. In fact, there was a survey conducted that identified, in fact, that food allergic consumer community in Canada would go more easily to Anaphylaxis Canada's website, when it used to be called that way, than actually the Canadian Food Inspection Agency's website for recalls. This was, of course, before Twitter and Facebook existed, and where you could essentially have immediate access through a text message about your recall. But again, they became the reliable source of information, and that did not happen in a vacuum. In fact, it happened completely in connection with the regulators, completely in connection with the industry groups. I mean, one of the scenarios about how a recall would be administered, it involved also the consumer organizations. The industry would call the consumer groups to notify them, this is something that we would like you to announce to your constituency and your membership. And again, this showcases really the effectiveness of these type of collaborations. Those organizations contributed also in developing guidance, in developing best practices that went beyond, serving directly their constituency, so serving indirectly the constituency. Like, for example, best practices for school catering, best practices related even to training food service establishments, where we know that a number of incidents can actually come as a result of potential errors from a number of workers that may be lacking some training. So clearly, this allowed to have the most effective risk management approaches. And when you look essentially at the continuum of risk management approaches, from a regulatory standpoint, where you have no intervention on the part of government, so no regulation, up to the direct command and control, in terms of regulations there, you can see that there was an intervention of all the partners at each level. So, for example, recalls were enacted, as I mentioned, without even a regulation. There was a section in the Food and Drugs Act that was used, and that actually was not challenged in order to protect food allergic consumers. And again, any type of recalls was completely relayed, not only by the consumer community, but also with complete compliance from the industry sector. On the self-regulation, information and education elements of that continuum, the development of codes of practice, the dissemination of training, guidances, relaying the information about recalls and consumer advice, that also involved all the partners, from regulators to consumers as well as industry. And there was even, from a self-regulation and incentive-driven approaches, a number of consumer groups, actually 2 consumer groups in Canada, developed their own food certification programs. The allergy group in Quebec developed a program called Allergen Control Program, and the Canadian Celiac Association developed a gluten-free certification program. So essentially created incentive as well for industry to provide more access to nutritious food to their constituencies. Now, if we go back and try to see, why this has worked and what were the main drivers, I guess in this particular case, clearly there was a shared interest and a shared concern by everybody, that everybody coalesced around. The dialogue was absolutely continued, and I can tell you that as a regulator, we learned, amongst ourselves that we would not have a discussion about a risk assessment or a risk management approach without having all these players around the table. We may forget one of them on another file, not on this one. Essentially, everybody had to be involved, and in a lot of instances, the approaches that emerged ended up being consensus approaches that were advocated by the community of these groups, not something that the regulator necessarily came up with. Transparency was a key element as well, so everything was made available, shared, and communicated. The advocacy groups were very close to their constituencies. I can tell you again that there's nothing that makes you essentially sensing the importance of this issue, or even being very enthusiastic about it, than actually meeting a number of mothers of food allergic kids. I can share stories about those, and again, these are compelling stories, and again, thanks to these advocacy and consumer groups, you could know what is the issue that is being, or that needs to be addressed. Again, I don't believe that any of these consumer groups were looking to be publicized or media, present. They were clearly serving their constituency and addressing the risk that their constituency was facing. And there was definitely a culture of collaboration being built. I think the premise of the discussion, the first premise of discussion between industry and consumers, and we facilitated a number of those, there was never a sense that the consumer organization was thinking that the industry was doing something on a deliberate way in order to actually cause harm, but rather there is a problem. We would like to have access to safe food. We would like to create more trust in the labels, and how can we address that? And I guess a fundamental ingredient, trust. Trust was really what helped and what shaped the way this collaborative approach developed and helped it to be effective. So I think actually we're going back to an element that was mentioned even in the first talk about the importance of this in partnership development. Now, this was maybe a small case at the domestic level, just to showcase the importance of the contribution and the collaboration, and in fact, the partnerships. I mean, this partnership was actually even structured at a level of working groups and essentially existing fora for dialogue, and knowing that the issue of food allergen management does not stop only at the implementation of labeling of ingredients. There are many other things that need to be addressed, and therefore this type of approach helped to sustain the maintenance of this type of effective risk management approach. Now, speaking of other examples at the international level that I thought could be interesting to share, Codex itself relies heavily on partnerships. I mean, when you look at the way Codex is built, you have 186 countries, but you have more than 220 observer groups that actually represent the stakeholder community. And their number, by the way, the number of countries is limited. So, and there aren't actually countries that join every year. But the number of stakeholders and partners that join the Codex community increases every year. And essentially, again, it's the manifestation of the way the risk analysis principles should be implemented. Those partners are, of course, availed with the opportunity to provide comments and input on every standard that is being developed, and, of course, to attend the discussions and the deliberations around international food standard development. Another role that these partners actually play, and is key, in fact, in the way Codex standards could be effective, is the way Codex standards are implemented. In a lot of instances, Codex, the international food standard setting body, sets what we call outcome-based standards. They essentially set what needs to be achieved, at what level. They do not necessarily, the standards do not necessarily specify how that goal or objective needs to be achieved. And in order to come up with the guidance and the way that requirement could be achieved, you need partnerships. You need collaborations in order to do that. And the example I used is when you have a maximum residue level that is set for, say, a substance, a veterinary substance used in conjunction with animal production destined for food, the way that MRL is to be achieved is highly dependent on changing animal husbandry practices, looking at administration withdrawal requirements, looking at quality assurance requirements, also looking at how these practices could be applied not only at the large farms, but also at the small production practices. And this is an example, a set of tools and guidances that were developed essentially by FAO and WHO, but with the input of the partners that I mentioned that are so critical in the success and the effectiveness of international food standards. So clearly, in the context of food safety, nobody discusses the fact that it is, a key element. It is in fact the connector between health, trade, and agriculture. You probably have seen the WHO report that was published in December of 2015 indicating that the burden of foodborne illness affects 1 in 10 people on the planet. Over 400,000 individuals die every year as a result of a foodborne illness. The connection to trade is evident. Unsafe food does not travel well, let's put it this way. And when you have a trade at the level of $1.5 trillion and increasing, it gives you the importance of that. And again, food safety is critical to the agricultural sector and to food security overall. So I guess for that, you see a number of investments being conducted both by the public, the private sector, and academia in food safety competency development. Everybody realizes that in the context of a food supply chain that is highly globalized, where ingredients are being sourced from all over the place, it is the interest of everybody that this supply chain is as safe as possibly be, as reliable as possibly be. Industry invests heavily in training their suppliers. There are a number of programs that are really aimed at doing that. Public organizations, whether be it international organizations or governments, as part of their development initiatives, they also invest in food safety related programs, upgrading food regulatory systems in developing countries, specific initiatives targeting some supply chains. Again, one of the issues is that a number of these initiatives can target several goals, and essentially you may have potential for duplication, you may have potential for less effective use of resources and so on. It is for this reason that a number of partners met in 2012 and with the support of the World Bank identified the need for better coordination and enhanced effectiveness of food safety capacity building, and decided to create a public-private partnership called the Global Food Safety Partnership. This is an initiative that is hosted by the World Bank, but the World Bank is not the main actor. They are practically the host or the facilitator between governments, between industry, and the academic sector. Now, the initial founders or donors, and there's a hope that this actually increases, are essentially Canada, the United States, the government of Denmark, and the government of the Netherlands were the founding members of the Global Food Safety Partnership. And two corporations were the first to donate to this initiative, Mars Corporation and Waters Corporation, Waters being essentially a supplier of instrumentation or tools that support food safety practices and their implementation. Now, what is the objective? The objective is as simple as this. There are so many initiatives. The idea is not necessarily to create new ones, but essentially to try to make them more effective, to make them work together more closely, and to maximize potentially their impact. One of the ways to do that is to try to align public investments with private investments. As I mentioned, the private sector, industry in particular, invests in a lot of competency development in developing countries, particularly, at the bottom side, trying to make sure that their supply chain is more reliable and you have more food safety practices instilled as part of their, suppliers. And of course, trying to do that in alignment with what international standards and international best practices advocate. At the public level, a number of international organizations, but also aid agencies and governments contribute to capacity building and competency development in developing countries, particularly to upgrade food safety regulatory systems. And the idea is to achieve the best outcome is that we need to make sure that one knows what the other is doing at the very least, and at best, essentially, to try to align and coordinate these initiatives and potentially to maximize their impact. You see that at the center, the idea as well is to have Codex standards be a guide for this. The idea is that this will contribute not only to address food safety issues and therefore public health outcomes, but it will also address economic development because safer food or upgraded food regulatory systems will lead to better access to markets and hopefully a freer flow of the food and agri-food commodities that are traded. Now, this is the approach that the GFSP, the Global Food Safety Partnership, is trying to implement. As I mentioned, it's trying to find the alignment between some public initiatives and particularly global initiatives. In fact, the World Bank invests heavily in a number of loans that are given at a very low interest rates, specifically dedicated to upgrade food safety systems in developing countries. The idea is that these investments, such as the World Bank loans, but other initiatives funded by FAO, WHO, a number of aid agencies, try to make them converge with a number of local initiatives that are being suggested or implemented by partners on the ground. And even actually, the intent is to try to multiply the impact of those local partnerships or local initiative. One of the approaches that is being advocated, and this is a model that is being in trial phase at this point, is essentially to ask small partnerships that are being formed in developing countries to come up with a project where clearly they identify, the objectives, the alignment with a couple of international initiatives and so on, but come up with some seed funding. That seed funding is aimed at being multiplied in order to have a bigger and a stronger and hopefully more sustainable impact through the donor and through essentially the trust fund that is constituted by the Global Food Safety Partnership. It remains to be seen essentially how effective this model is going to be. It's being tried, in fact, as we speak, and perhaps there might be some lessons learned in the way this type of partnership is being administered. I welcome also your input and your ideas on this way. Now, maybe shifting a little bit gears and moving from food safety and nutrition to nutrition and sharing with you a few thoughts in this area. I'm sure, I'm speaking, this is my first participation into a Canadian Nutrition Society meeting, so I'm quite actually intimidated being in a forum of nutrition experts, but I believe that you would agree with me that the impact of non-communicable diseases and nutrition risks is actually well documented and requires attention from a risk management standpoint, and probably from the intervention of regulatory and non-regulatory tools. Again, given that all the actions have to be evidence-based and evidence-supported, we know that there are some challenges related to the implementation of these risk management measures. Well, first of all, a number of the issues are multifactorial. The risks are not only associated with the composition of a food. When you have a contaminant in food and you need to basically prevent the illness, you act primarily on the contaminant. That's usually the most effective way. When you have issues related both to food formulations, but also to consumption behavior, to dietary habits, and so on, that can create more issues. Also, the fact that risk management approaches, and maybe this is a perception I have, they may need to be more iterative than in the context of food safety. Again, food safety risk management approaches have to be iterative because you need to evaluate the effectiveness and go back and potentially suggest other measures. But again, consumption behaviors and the way they are changing right now may dictate to consider this even more for nutrition risks. And I believe that capacity building in the context of nutrition risk management tools and their implementation, and particularly even in the context of building regulatory frameworks in developing nations around addressing nutrition risks, may require even more attention. Now, some of the things that I have observed, and here I would like to be potentially contradicted or, I don't know, confirm these perceptions. So I'm actually caveating this by saying these are perceptions on my part. Nutrition issues tend to be highly polarized. I don't know, for some reason, more polarized than food safety issues. They tend to have a high visibility as well. The opinion leaders and the advocacy groups usually can be vocal against partnerships and collaborations when industry are involved. Perhaps, again, there might be conditions that could be set, and maybe there is a nuance there, but you hear more often, controversies about collaborations where both industry and other partners and public partners are involved. And there is a potential, or maybe this is my perception, that it is somewhat a low-trust environment. And again, when you look at the way industry is innovating and developing new products with functional ingredients, with different formulations, and the way the regulatory agenda is moving, you find quite an opposition. Industry is definitely innovating far more quickly than the regulatory agenda is moving. One could even say that the regulatory agenda may be somewhat stagnating. So, in that context, a couple of approaches to discuss in terms of, how could this be addressed? And you remember the continuum of regulatory approaches that I shared with you, from zero intervention up to a direct command and control regulation. And by the way, I did not come up with this. I took it from a paper that was published in 2007. And there is potentially an opportunity where collaborations and partnerships could coalesce around, and that's the notion of co-regulation for issues where the regulatory or pseudo-regulatory lever might be useful in addressing a nutrition safety risk, and where there is a potential for higher collaboration. By the way, the definition of co-regulation, just to make the difference, and I'm going to paraphrase it, self-regulation is generally a set of measures that are developed by industry and imposed by industry to itself. Okay, of course, it's addressing an objective that usually meets, either a food safety objective or regulatory requirement, but it is a self-imposed, type of process. A co-regulatory mechanism is different in that it is still developed primarily by the sector, and perhaps with collaboration with others like academia and consumers, a set of risk management approaches that are developed by the sector, that are self-imposed, but with some level of oversight, contribution, or collaboration on the part of the regulator, such that the regulator deems that the measure is effective enough to address the risk, and they don't need to intervene. That's essentially the type of approach that could be advocated here. And in fact, it is followed in a number of food safety approaches, particularly in the way, for example, a number of substances are used in conjunction with food production, chemical substances. In a lot of instances, the regulator actually develops requirements, and it is left to industry to develop these measures, but actually with some level of control and oversight, or at least review on the part of the regulator in order to ensure that essentially the safety requirements, for example, are met. So this could be an avenue of discussion in order to foster future collaborations. And I can see also a number of other opportunities, that could be potentially used in order to foster a different climate of collaboration in the context of addressing nutrition risks. PAHO has, I believe, started an initiative at least a couple of years ago related to regulatory capacity building, specifically to address NCDs, non-communicable diseases, and particularly nutrition issues. There might be opportunities here to benefit from some experience in competency development and capacity building in food safety and applying them to this particular area. There's also potential to use the leadership of the international organizations responsible for food in order to pave the way for the creation of an improved climate of trust and collaboration amongst the different partners. One of the examples that, and here I'm no longer a regulator, so I can express my opinion very freely on this topic. I was actually very surprised by the current position stated, and perhaps it will change, by the World Health Organization to exclude industry from a number of discussions related to food and nutrition. I think a culture of exclusion is not necessarily helpful to building risk management measures that are effective. And, there might be opportunities for changing that. I know that FAO, which is a sister agency in the UN system, and also having a co-responsibility on food, is actually applying a different approach. And they have even a partnership group that promotes collaboration and support to the inclusion of industry within a particular framework. Of course, having guidelines, requirements that are associated with industry's involvement are absolutely needed. Having a culture of exclusion is not necessarily helpful. At the domestic level, there might be some files that could be used in order to learn from and potentially, further developed in having that collaboration and partnership. I'm going to use the sodium reduction file, for example, where a voluntary approach was followed by industry, of course, guided by government, and essentially a number of reformulation efforts were made. But again, in order for this to be effective, there needs to be active monitoring, there needs to be, an open dialogue and sharing of data and more transparency about the progress that has been done, and essentially to accompany these measures with a number of others, like, for example, what may support changes in dietary habits. And again, these might be very simplistic, proposals, but these could be maybe starting points of discussion. So I guess my last message is that when you have complex risk issues to address and risk management approaches, having a culture of collaboration, building trust, having inclusiveness is actually a key ingredient to achieve the best outcomes in addressing these risks. Again, really thankful to the organizers for including me as part of this workshop and looking forward to further discussions. Merci.
Thank you very much. It was a really, really interesting presentation. And I suppose it's more of a comment to that question with respect to your idea around co-regulation. I think this is a really, really interesting move and something that should be really considered. And in fact, in Ireland, we've started off in this area, in the area of reformulation. So we initially worked with the industry and we developed guidance with the industry. And then we said to the industry, right, it's over to you to do whatever it is you're going to do to reformulate the products. And then what we'll do is we'll come in and verify that you've done what you said you're going to do. Now we're at that point of going in and verifying what they're going to do. So it remains to be seen whether this approach to regulation works. But it is an interesting model, and it's one that's been, I suppose, looked at and considered across Europe. And I suppose what I'm saying a little bit is that, in fact, it's worked on the sodium side here in Canada as well. So I think there is a need, absolutely, for collaboration, and there is a need for guidelines around that collaboration where industry is involved, because I don't think we can move forward without that level of collaboration and partnership. But at least there are clear guidance and guidelines around how that interaction happens to remove potentials for conflict of interest. So thank you very much.
Thank you.
I have one last question for you. Could you comment on, because you really provided some really broad you provided some really broad examples. How about risk management in terms of smaller files or portfolios? Is the same approach required, or is it a different approach?
Well, technically for any risk management file, if you look at the guidance that we receive internationally and should be applied for anything, the most effective way is really to have these risk management approaches developed and implemented in collaboration. The development in itself actually needs to involve all the partners. There is no way to develop a risk management approach if we do not test its effectiveness or even its feasibility, even its achievability. And there's nobody else that would be able to tell us that than actually those who produce the food, for example.